acceptable that in the age of artificial intelligence and space tourism, a Nigerian child should die of malaria because her mother couldn't afford to travel to the nearest health facility. It is unacceptable that young people in remote communities go blind, untreated, because there's no eye clinic for hundreds of miles. There are not just, or these are not just failures of infrastructure, they are failures of empathy and leadership at all levels. CARE365 reminds us that technology can and should be human, that innovation should uplift, not to isolate. Technology should be for inclusion and make health services available to all. Your Excellencies, ladies and gentlemen, I want to commend the visionaries behind this remarkable initiative, the developers, health professionals, partners, and investors who have chosen to innovate for humanity. You are the health heroes of today. But your journey does not end with this launch. It only just begins. The true test will be how quickly these hubs reach our IDP camps, our border communities, our remote rural areas, our riverine areas, and our inner cities. The true success will be measured not by apps downloaded or kiosks deployed, but by lives saved and dignity restored, by how much Nigerian life expectancy is enhanced. To the federal government, I urge, Minister,
Hello.
I urge you to fully integrate CARE365 into our primary health care and emergency system. To state governments, adopt and domesticate it. To donors and development partners, support it. To the private sector, invest in it, particularly the banks.
And if you are a good tree with good fruit, definitely you should take tools. I don't know why people are making somebody who is not worthy to be popular.
To the media, tell its story, herald it, and regularly report on its progress. Let us all become ambassadors of access, advocates of care, champions of dignity. We can all be our brothers and sisters keepers through participation and contribution to this hub. This morning I was saying to General Salami Abubakar that I pray that this will be a great success. If it is, it will only be second in terms of affecting our life generally to this. The effect of this on our life, no matter where you are in Nigeria today, is immense. And I believe that this CARE365 Health Hub system can be only second to the mobile telephone in our life. In conclusion, as a proud Nigerian and an incurable optimist, I believe this country will rise. But that rise must be inclusive, not rise for some and download for others. It should be rise for everybody. But the rise must be inclusive, and inclusive progress begins with inclusive health. Health for all. Thank you for the honor of giving me this role, General, and all of you who are involved in this exercise. Thank you for believing in a healthier Nigeria, and may God bless the CARE365 Health Hub. May it heal not just our bodies, but the heart of our nation, because the heart of our nation needs to be healed. Thank you, and God bless you all.
Please put your hands together again for His Excellency, former President and Chairman of this occasion, he deserves a big round of applause. He has shown us he is still healthy, strong, and fit. Thank you, Your Excellency, for those fatherly and inspiring words. In no any special order, may I crave your indulgence to recognize the following personalities who are here with us. Dr. Samuel Ogbuku, Managing Director, CEO, and communication. Dr. Adabi, Director, Zenith Bank, is representative of Zenith Bank. Also here is the Director General, NAFDAC, Professor Chola Adeyeye. We also have the Executive Director, CEO, National Primary Healthcare Development Agency, Dr. Mui Aino. Dr. Yomi Jaye, MD, Cecil Health, one of the partners of CARE365, is also here. Please put your hands together for him. Please welcome warmly Dr. Abayomi Ayegbosi, General Manager, Veritas Capital Assurance PLC. We also have Honorable Engineer Bello Lawal, President Algon. He's here, I think. Please put your hands together for him. Next don't swing your camera too much. Is to we will hear from the visionary behind the CARE365 Health Hub. Please welcome the CEO and founder, Mr. Ngozi Joseph Odumoku, to deliver his welcome address.
The transporter. What's the problem? It's not the transport. It's the camera. This is
His Excellency, former President of the Federal Republic of Nigeria,
What of the fourth camera? What of that? That guy that's
Chief Olusegun Obasanjo, the chairman of this occasion. His Excellency General Abdulsalami Abubakar, former head of state of the Federal Republic of Nigeria.
Yeah, they hear you.
I greet you.
Yeah.
I call him my daddy. His Excellency, the former president of the Federal Republic of Nigeria, a man of peace, Dr. Goodluck Ebele Jonathan. His Excellency,
What is holding that other one now?
the Coordinating Minister of Health and Social Welfare, a global resource, a gift to Nigeria, and a blessing to the health ecosystem.
This one is linking now.
Professor Ali Pate, we thank the World Bank and international organizations for letting him go and to come serve Nigeria. May I greet High Excellency, the Minister of State of the Federal Republic of the Federal Capital Territory, who is ably representing the Minister of State himself. You're most welcome, ma'am. Our great and visionary leader, who is turning around the Niger Delta and doing great impact to the end of the sea, a great scholar, an interventionist, and a great resource, Dr. Samuel Oboku. Special thanks and welcoming and acknowledgement to a great partner who are major in our delivery of this project from the very get-go, who enabled us to come this far, no other than Zenith Bank, the ED of Zenith Bank, Dr. Adobe Nwapa. Please permit me to stand on this existing protocol. Before doing that, I have to recognize my good friend and brother who we are working with together, Dr. Yami Jaye, the MD of Sensi Health, the DG of NAFDAC, the EDCEO of National Primary Healthcare Development Agencies, the representative of the governors, and all existing protocol. May I move into the very core of why we are here. I also proactively apologize if I have not mentioned your name.
Mommy.
We are here today to celebrate and to acknowledge an innovation. We are here today to celebrate and acknowledge an innovation that started with an inspiration from God. I am a Nigerian, a proud Nigerian, and also an American. I live in America, I work in America, and I do everything in America. While in America, this vision and idea to innovate this product came to be. And through the help of God, I'm privileged to connect with His Excellency General Chief Olusegun Obasanjo. On his invitation to Washington, D.C. last year, he gave us the privilege to interact so he can enable this. It was through that we got a blessing to connect with our chairman, who is now my father. I adopted him, calling my daddy, General Abdulsalami Abubakar. From that very goal, the accomplishment and coming to fruition of this initiative became possible. His Excellency General Abdulsalami Abubakar is the force behind this actualization. God have used him to make this come to fruition. He has championed this and provided everything we need to ensure we are here today. The reason for this vision is to make accessible healthcare, affordable healthcare, quality healthcare, and available healthcare available to the citizens of Nigeria. We are here to envision and to support the federal ministry, agencies, and businesses to be able to provide adequate care for every citizen. Because care for citizens matter a lot. The idea for this care is to provide, through technology, an accessible point where, through, as we do in the West, in America, in Canada, in UK, people can from their kitchen, their office, access healthcare. And this is what we're about. Through this, we developed a system that connects through application. You're able to download this on your phone, and through your phone, you're able to access and connect with our doctors in America, in Europe, in Asia, and in Nigeria to discuss your healthcare needs. From that application is connected to our mobile kiosk, which is here, we'll be unveiling. The mobile kiosk is able to check for your vitals, your invasives and non-invasive tests. And all of that stuff connect also with the application that doctors can discuss with you on the spot to assess and do clinical examination so you can be able to get quality healthcare. From that point, we're able to connect with our mobile clinic that has bed and has everything in it to be placed in rural areas, in semi-urban areas, in urban areas, and everywhere so that we can help to bring care closer to the people. It is for this reason that we feel that CARE365 matters. This is the first ecosystem that in one single source of truth is connecting providers abroad, providers locally, connecting the mobile clinic, connecting the kiosk, and connecting with providers everywhere. Therefore, we consider this a privilege to be here today, to be given this platform to showcase what we're about. The Federal Minister of Health himself, Coordinating Minister of Health, we do the unveiling, and at that point, more details about this innovation will be explained to us. We consider this today a great privilege to be here, to be able to showcase this, and it's a privilege to be hosting the presidents, former presidents, and the leaders of this ecosystem. We say thank you, and may the Lord bless you, and bless Federal Republic of Nigeria. Thank you.
Thank you very much, Mr. Odumoko, for your passion and dedication to this transformative journey. It is now my pleasure to invite. Okay.
Let's very quickly recognize the following distinguished personalities before we call our next speaker. Her Excellency Princess Adejoke Elokpe Adefulire, Senior Special Assistant to the President on Sustainable Development Goals, is here in her capacity on that role. Please put your hands together for her. We also have Bala Ibrahim, Secretary to the Government of Bauchi State. So, I beg your pardon, of Jigawa State. He is ably representing the Executive Governor of Jigawa State. Please put your hands together for him. Also here is Professor Mohammed Kuta Yahya, Pro-Chancellor Abdul Qadir Kure University, Minna, Niger State.
You're welcome, Your Excellencies. It is now my honor to invite the Chairman of CARE365 Health Hub, His Excellency General Abdul Salami Abubakar, GCFR, to deliver his remarks. You're welcome, sir.
Please put your hands together for our Chairman, CARE365 Health Hub.
Please to be seated. Thank you. Your Excellency, my Oga, General Chief Olusegun Obasanjo, I want to thank you for being the chairman of this occasion. Thank you very much for coming. Your Excellency, former President, I want to thank you. Jonathan Ebele, thank you for coming. To the Honorable Minister of Health, I want to thank you. Despite all your programs, you canceled them to attend this function. I want to thank you for the honor. the Honorable Minister of State, FCT, I want to thank you for coming. Your Excellencies, I can't mention all of you, so I beg you to stand on the existing protocols. But before that, I want to recognize the representative of Mr. President. Thank you for coming. I tell you a story how I became the chairman of this CARE365. I came back from a medical excursion. My staff told me President Obasanjo has phoned me, is looking for me. And my Oga was in America. You know, General Obasanjo is not somebody who stays 24 hours in this country. He is always galloping from one country to the other. So I called him back. He said, General, I have got an assignment for you. I said, you know, your order is a command. So what can I do for you, sir? He said, there is a young man who is an engineer who lives in America but has turned towards his attention towards medical care. He wanted me to be the chairman of that CARE365. He said, General, you know my plate is full. So I ask you to take over as the chairman of this occasion, of this organization. So I said, sir, you know I'm not too well. He said, shut up. So that's how I became the chairman of this organization. Well, Mr. President, thank you for roping me in. I want to thank you, and I'm glad to be the chairman of this CARE365. To Engineer Ngozi and the founders of this CARE365, I want to thank you for giving me the opportunity to chair this laudable company, so to speak. Your Excellencies, ladies and gentlemen, in my capacity as a soldier, I have traveled up and down this country. I have served from the north to south, from east to west. And during my tenure as the head of state, I also traveled a lot in the country. And one of the things that really attracts my attention is our medical care. As the chairman of this occasion has said, there is no facility all over the country to access medical care. So this CARE365, working together with the Ministry of Health and the state governments, will provide an answer to this problem. To the Minister of Health, I again want to thank you for finding time to come and unveil this CARE365. Now, as the chairman of the occasion said, launching this thing is not the end of the problem. It's the beginning of the problems. It needs support from all of us in the way we can assist to deliver health care in this country. In his speech, Mr. Ngozi has alluded to the fact that God has gifted Nigeria with the current Minister of Health. I think since he has taken over, a lot has been done to change the delivery care, health delivery care in this country. Your Excellency, Honorable Minister, I want to thank you for what you are doing. To all of us, as I was saying, we need to support CARE365 in order to deliver health care in this country. I want to thank all of you for as I said earlier, it needs all our support. So please support this CARE365 without any chooks. Thank you very much for coming. Chairman of the occasion, I want to thank you. I know you are going to Algiers today, but since you roped me into this, that's why I brought you here, despite the fact that you are traveling. And I want to thank you. You heard him saying, I'm his Oga, and you know he is joking. He is our Oga. So our Oga, thank you very much for coming, and I want to thank everybody for coming. I forgot to recognize an individual who has been up and doing, and that is Dr. Amina Sani Bello, whom I roped also to be a member of the board of this CARE365. Dr. Amina, I want to thank you for all that you are doing and you will continue to do. Dr. Amina is my daughter, so I have asked her to join this CARE365. So most of the job she will do is on my orders. So Amina, please carry on with the CARE365 and do all the best you can to assist this organization. For coming. God bless Nigeria, and may health care continue to grow from strength to strength. I thank you very much for listening.
That applause is not loud enough for our chairman.
A round of applause, please.
Thank you, Your Excellency, for those encouraging words of leadership and vision. Please keep the applause until he sits down. Thank you. Thank you, thank you, thank you, thank you. Let us very quickly acknowledge the presence of the following personalities. Once again, a big round of applause as he sits. Thank you. We have in our midst the representative of the Executive Governor of Nasarawa State. Mr. Yakubu Lamai is the Director General of Strategic Communication to the Executive Governor. Please put your hands together and welcome him warmly. We also have Mr. Shama Ezekiel, Regional Manager, United Bank for Africa. He is representing the Group Managing Director of the UBA PLC, Mr. Oliver Alauba. Also here is Dr. Umar Muntaka Sadiq, National Coordinator for Sector-Wide Approach at the Federal Ministry of Health. He is also here with Dr. Mui Aino, Executive Director, CEO, National Primary Healthcare Board, still at the Federal Ministry of Health. Please, another big round of applause to these personalities. They are here and they grace this occasion. Dr. Razi?
Okay, thank you, Your Excellency, for the encouraging words of leadership and vision. Distinguished guests, please join me in welcoming the Coordinating Minister of Health and Social Welfare, His Excellency Professor Ali Pate, to deliver his speech. You're welcome, sir.
His Excellency, the Chairman of the occasion, former President Chief Olusegun Obasanjo, His Excellency, former Head of State, General Abdusalami Abubakar, Chairman of the CARE365 Health Hub, His Excellency, former President Dr. Goodluck Ebele Jonathan, the representative of the Vice President, my colleague, the Honorable Minister of State, representative of state governors, heads of federal government agencies and parastatals, and my senior colleagues, senior brothers, Senator Pius Anyim, who is also here, other leaders of the private sector, health workers, and I would like to recognize the National Health Fellows. I believe I saw a few of them, a few health fellows that are here, very young, innovative, driven Nigerians that we have, one in each local government of our country. Glad to see you. Ladies and gentlemen, it is indeed a great honor and with a deep sense of duty that I stand here with you at the official commissioning of the CARE365 Health Hub product. This is bold, this is timely, and much needed innovation. I want to thank Dr. Ungozi, Engineer Ungozi, the founder of CARE365 Health Hub, all the members of the board of CARE365 who have brought advancements in healthcare. This hub that we are going to launch today represents a very practical, innovative solution to one of our most persistent challenges, ensuring that quality health services are available and affordable to all Nigerians, especially those in underserved and remote communities. such as mine in remote part of Bauchi. And through what we will see through the kiosk, I think you will all understand the import of this innovation in terms of what it will do for poor women, children, displaced populations, marginalized populations, by making it possible for them to access healthcare. It is an opportunity for our healthcare system to leapfrog, and it fits squarely within the context this administration is trying to do. The transformation of Nigeria's health system is on the way. Under the leadership of His Excellency President Ahmed Tinubu, we had a 4-pillar strategy, one of which is governance, to ensure that we orient our health system to serve our people, to work with states, federal government, local governments, civil society, private sector, to orient our system to serve the needs of our population, and to ensure that no one is left behind, to regulate it such that the public mission is protected, but to have data and also be transparent and accountable to our population. The second pillar is to improve the health outcomes by expanding primary health care. On the supply side, this CARE365 hub is an important contribution in that direction, but also to make it affordable by ensuring that there's a payer. The health insurance is being expanded to ensure that affordability is also taken into account, and referral system to higher levels of care. The third pillar is to unlock the healthcare value chain. There is a value chain, and it's no surprise that there are many private sector actors, Zenith Bank and many others who are here. There is an economic value in health, because health is an investment. It provides services, but it can create jobs. And in healthcare innovation, there are opportunities to create hundreds of thousands of jobs in just managing this, not only in directly providing the care. And fourthly, to ensure health security, because if we have these technologies, we saw during COVID, it was not even possible to visit health facilities. Digital technologies provide the avenue for schools to operate, and healthcare can function if you have platforms like this. But the cross-cutting effort, the cross-cutting enabler of all of these pillars is digital transformation, allowing us to organize, use technology to leapfrog. And so I thank the proponents of this for really bringing it to fruition as a good exemplar of how we can leapfrog our health system to ensure that our people are served. I would like to thank everyone who is here, and with that, I have been asked to formally commission, and I hereby commission this CARE365 Health Hub to the benefit of all Nigerians and for the glory of God. I thank you very much for giving me the honor of commissioning it. Thank you, Your Excellency.
Your Excellency, you are also expected to do the formal unveiling, and you are not doing it alone. We want to respectfully call on all our special guests to join the Honorable Minister for the formal unveiling of this CARE365 Health Hub over there, sir. Yes, sir. The special guests, former presidents, Minister of State, Health, Minister of State, FCT, all the people on the, is it top table now we'll say, or the front table or the front seat? Please put your hands together for this unique event, because this is the significant highlight of today's ceremony, the official unveiling of the CARE365 Health Hub, to be performed by His Excellency, the Honorable Minister of Health and Social Welfare, Coordinated Minister of Health and Social Welfare.
So, ready to go? Okay. So I hereby unveil this CARE365 Health Hub platform to the glory of God and for the benefit of all Nigerians. And may God bless.
Round of applause, please.
A big round of applause, please. It's not loud enough. Thank you. Thank you. Thank you, Honorable Minister, and all the dignitaries for this unveiling of the milestone initiative.
Yes, so I'd like to do a quick walkthrough on this device. This is called the CARE365 Health Monitoring Kiosk. And what this does is that over here, Mr. President, the minister, anybody, even in a village, in the urban and rural areas, can come sit over here. When you sit over here, depending on the test you want to do, over here we have 6 panels for ECG. You can check for your heart, things ECG about your heart. Then you can also check for your blood pressure. This is the cup for blood pressure. Over here in this tray over here, you'll be able to put, the kits over here to check for malaria, HIV, hepatitis, and lipid profile. Over here, when you open it, it has the keys over there. We have all the tools in of it. Let him open the box. We have the kit inside of it to check for lipid profile, cholesterol, sugar, and all the parameters over there. Then over here too, you're able to check for various indications, like over here you have for pulse. This one can check it for your temperature and the rest of it. Then you're also able to check for different kind of parameters, from glucose to here this 8 is on right now. You have the ECG, you have the BCA. BCA is body composition analysis. You have for weight and BMI. You have for XPO2, and then you have for the invasives. The internet is coming up. You have for the invasives and non-invasive tests as well. So for the invasives, you also have for markers that can check for different things over here to check for everything going on in your system. And immediately the result will come out. And when the result comes out, doctors are able to consult with the doctor on the machine device instantaneously. And these doctors are in America, in the United Kingdom, in Europe, and in Nigeria. We have some of the clinical chiefs here. Professor Yahaya Adamu is here. Professor Aka Haji is here. These are our clinical chiefs. Dr. Amina Bello is here. They're able to then evaluate everything going on here. We also have GI doctors. We have neurosurgeons, every kind of specialty on our ecosystem. Then it's also connected with our app, right? From that app, everything you see here integrates to your phone. So that if you want to check any doctor anywhere with those parameters, rather than carrying paper, it's synced up with that app, right? So the entire service comes up here. Then you can select and do whatever you want. You can do it here. All the baselines are over here. So we are right now collaborating with NAFDAC because this machine is FDA approved in the US. We've also gone through with the NAFDAC right now for their own clinical processes. Before we do the pilot over here, we've done some demos in NDDC. We thank the NDDC MD, his facility in Port Harcourt. We did some pilot over there in what we call the NDDC Clinical Outreach Mission in Port Harcourt. Over 10,000 people, they went this process and were able to do a great impact. And we also went to Anambra with the Sir Emeka Ofo Foundation to do for the widows over there, for over 7,000 widows. We did some pilots there, and the NDDC MD here and the people were so gracious and very wonderful to us. So this can be placed in villages. So, and now we have the Huawei that is collaborating with us to provide internet services and also solar services, so that when we put it in anywhere, there will be no disruption, right? Even if there is no internet over there, it comes with this internet, with our collaboration with Huawei, and power. Even if there's no power in the village, in riverine areas, anywhere, they're able to connect. And this, again, will create what we call job opportunities. We'll be able to train people locally that will be able to operate it, operators. It's very easy to use. This also connects with the clinic. We have a mobile clinic. This one here is outside because it's very big. It has bed, it has everything. This one will be inside of it. So with this, we have a complete ecosystem, the kiosk, the mobile clinic, and then application. That application connects with the doctors and people are fine. And then we are collaborating with hospitals locally, right? We are handshaking with primary healthcare centers, shaking with local pharmacies, and we are handshaking with local imaging centers, laboratories, and the rest, so that we can also share, do cross-validation and the rest of it. All right, so we'll also repeat again so that everybody can see. So it's seamless stuff. We can do demo, maybe after this, not to waste anybody's time. Again, we are happy to bring this. Thank you, Mr. President and the Minister. Thank you.
Chief Ngozi, please, can I have your attention here? Please put your hands together for Ngozi Joseph Odumoku, the founder, CEO of CARE365 Health Hub. On special request, Ngozi is required to once again put us through this explanation up here. Please put your hands together for Ngozi Joseph Odumoku as he comes over to explain the mechanism for all these technological applications. Please go ahead.
Thank you. I stand on the already existing protocol. I haven't said that. So here we have the CARE365 health monitoring kiosk. It's integrated into our mobile application and web application. So as I'm speaking, please we encourage the bad guys to try to see if they can project it to the last screen, please, okay? Please project it. Thank you. So a quick summary of what this is about. We have the healthcare monitoring kiosk. This is it. It's a health monitoring device. It's called CARE365 health monitoring device. To help this work seamlessly, we have what we call a mobile application and a web application. That mobile application, you can download it from the Play Store, okay, or iOS or Android, whatever kind of phone you're using. The name of the app is called CARE365 Health Hub. That app syncs up with this device. We also have the beautiful mobile clinic outside. Because of the size, we couldn't bring it inside. Maybe when we're going out, people can be able to see. It's also being shown on the screen. Thank you. It's being displayed. That's it right there on the screen. It's outside. 2 of them. Okay? So this has the mobile clinic, the bed for clinical examination, everything in here. Then this goes with this so that it becomes almost a quasi primary healthcare center to help in rural, urban, and semi-urban areas. Now, it also connects the mobile app, this one, and this one. Becomes a complete ecosystem. Now, how does it operate? You could, if you like, you could download it on your phone, all right, before you gain access. But you don't also have to do that. You could walk down anywhere. Take, for example, now, with the blessings of the kind of partners we have here, and by God's grace, we get everything going. We can deploy this in Zungeru village. And this is in Zungeru. It comes with its own power system, with our handshake with the likes of Huawei. Solar system, there's going to be light all through in the entire system. Now, when you come, and my old grandmother in Zungeru village says, I am having pain. Okay, Mama, come sit down over here. Mama comes down here and sits down, right? And this can be inside a mobile clinic. They work together. Or it can be a separate, a standalone. Mama comes here and sits down, and there's an operator that is from Zungeru village. This operator don't need to be a nurse, don't need to be a doctor, but if it's a nurse or a lab attendant, that's fine. What we do, we have our training ecosystem that is going to be able to train people for the utilization of these devices. So this creates an automatic job, great job for people, okay? So when we train you, you come here and you ask Mama, what do you want? My neck is paining me. Mama, please sit down, okay? Then we process some data, tests from Mama, so that you can do clinical examination through diagnosis and then prescription through diagnosis. Mama sits down and you check Mama blood pressure. The result comes out immediately. You check Mama temperature, check Mama everything, right? You could also pierce Mama to check Mama different kind, her sugar level, her cholesterol, and everything. The whole markers are there, and then the result pops up. The moment the result pops up, the doctor can say, okay, Sakinat, take Mama to the bed. The doctor is connecting remotely, right? Doctor is able to see everything about Mama clinically, right? Now, there is a bed there. They do clinical examination with the help of the on-site operator. Then after that, the doctor can then remotely engage and connect. We have integration with pharmacies to say, okay, I have seen what is going on with you, Mama. You have malaria. I have sent your medication to Med Plus, to Alpha Plus, and they can deliver to you, or you can go pick up. Once you go to MedPlus, you don't need to, MedPlus connects to our system. We have an account for them, okay? A user login, okay? That is only scope for only them. They don't have to see everybody's stuff. So we do partitioning. They're able to see that stuff and then release the prescription. Now, if there are complications, right? Because this is able to save life. Mama comes here and her BP is 290, 120. There's a danger right there. Immediately, we have an EMS system, emergency medical service system integration. We raise an alert, process Mama for a quick on-site help, assistance. So once that happens, Mama is able to get her quick treatment. Now, if the operators on site and our first intervention level in our clinical process, we have our doctors, they are here, Professor Haji, Professor Yahya Damu, and the rest, Dr. Zazi. Locally, we have clinical management team, then they're able to escalate to our consultant after the GP level. We have consultant in America, consultant in UK, consultant in Canada and Nigeria. If there is need for the consultant to come down to Nigeria, you don't need to fly and go if you don't have the money. It's expensive to go to get care in America. I live in America. My entire family is in America. It's expensive. American care is expensive. So rather than looking for dollars to go to America, we handshake local hospitals that have almost similar facilities, right? So our providers, neurosurgeons and the rest are able to come back here to schedule all those processes and perform the clinical procedures and everything here. So therefore, we are bringing care, quality care back home, right? Rather than going and the Japa syndrome. So we are reversing Japa back home. You get what I mean? So that everything, and finally, we are also in a point time T. By God's grace, with the kind of blessings we have here, we can set up local manufacturing plants in Nigeria. We built this in America, right? But what key thing our champions have done, we are making this affordable. After today, you can sign up to our app and through a subscription plan, very affordable. Even our care is less than 5,000 naira for our GP and the rest, okay? So we have that level. But with the handshake of the champions we're having here, we'll be able to deploy this everywhere and set up manufacturing plants in Nigeria. So Nigeria becomes the ecosystem for production in Africa. Pan-African solution. And let me say this. The reason we're able to come this far is because of the blessing of the coordinating minister. There can be no better minister of health than him. Very proactive, globally minded, broad-minded, and visionary. He understands the metrics. He's the smartest person I've seen, right? Very smart. I'm a numbers guy, but he beats me to numbers when we engage. So we have, Minister, sir, I doff my hat. So we are here today with that graciousness, gracefulness, and everything. Let me leave it here. God bless you all. Thank you.
Thank you, Mr. Odumoko, for that brief explanation. I'm sure everybody's thrilled about CARE365 Hub. We now turn to a very engaging panel discussion on healthcare innovation and sustainability. Thank you.
And the panelists are Dr. Samuel Ogbuku, MD, NDDC. Please put your hands together for him as he comes. Professor Mojisola Adeye, DG NAFDAC. Please put your hands together for her. Dr. Mui Aino, Executive Director, CAO, National Primary Healthcare Development Agency. And then Dr. Yomi Jaye, MD, Cecil Health. We also have Dr. Abayomi Ayegbosi, General Manager, Veritas Capital Assurance PLC. The last but not the least, Honorable Engineer Bello Lawal, President Algon. The panel will be ably moderated by Efuru Nwangpa, Senior Consultant Solicitor in the United Kingdom, and she is also legal advisor to CARE365. Yeah, I think the organizers, we will need an additional chair for the moderator. All right. Please put your hands together for this panelist. Okay, sir. Okay. All right. But before the panelists will commence their discussion, let me very warmly make these two recognitions. Dr. Magdalene Ajani, Permanent Secretary, Federal Minister of Interior, is representing the Honorable Minister of Interior. Please put your hands together for her. We had earlier recognized Professor Muhammad Kutaya here, Pro-Chancellor Abdul Qadir Kuri University. But he told us he is here representing the Executive Governor of Niger State. Please put your hands together for the former Governor of Niger State. Thank you. Thank you.
Thank you very much. Good afternoon, everybody. You're all very welcome to this historic event today. It is historic because, as has been said, it aims to provide a solution to Nigeria's healthcare infrastructure deficit. It is healthcare that's accessible, that is affordable, that will be potentially available to all Nigerians. And it doesn't matter where you're from, whether it's the north, the south, the east, wherever. This cuts across the whole of Nigeria and affects all of us equally. So we thank the visionary leadership of Ngozi Odumuko, who has championed this innovation. Like has been said, I'd like to welcome the panelists. We have the NDDC MD, the NAFDAC DG, NPHCDA EDCEO, Sessi Health MD, the Veritas Capital Assurance PLC, and Algon President. I don't know you one-on-one, so when I say MD, NDDC, just go ahead, please. Thank you so much. So I've been asked to sort of grill them, if you like, to see how their programs, their operations align with this vision. This is a visionary innovation, like has been said, and we would like to know how these organizations can support what has been done today. So I would start with the MD of NDDC, and I have two very simple questions, and hopefully you will be able to provide the answers that the audience would like to hear. So, you are an interventionist agency. This is all about technology, it's all about innovation. How can technology be deployed to help the agency in enhancing primary and universal health care? MD and DDC, please. Thank you.
Your Excellencies and invited guests, I think the CARE365, we have already subscribed to the CARE365 in NDDC. For NDDC, we have our free medical outreach, which we carry out in the 9 mandate states of the NDDC. Initially, we normally do once annually, but due to the high demand and the success ratio, we have decided to make it twice every year. The one for this year was actually flagged off by the First Lady of the Federal Republic of Nigeria in Bielsa. But when we talk about medical care, for us in NDDC, we believe that health is wealth. And for the nation to be wealthy, the nation needs to be healthy. So every individual life is very, very important to us. And for us, we believe that the vulnerable people are the ones that we need to reach out to. Because as an interventionist agency, we're not just there to intervene for the livelihood of the bourgeois. It is for those who are actually less privileged. And in order to ensure that we reach out to those who are less privileged, we came up with a digital e-health program where we are registering the vulnerable in our rural communities in partnership with the World Health Organization. And in the first phase, which we're supposed to register about 1 million persons, right now we have done over 500 persons that have been registered to the National Social Register, and to ensure that they have access to health insurance. So that is on one hand, but coming to ensuring that we also benefit from this technology of CARE365. For us, we believe that as part of our medical outreach, with this appliance, it is going to make life easier for our men and staff that are on ground in these communities. So for us, ahead of time, we had already subscribed with the manufacturers and Dr. Ongos himself. We already have one of these in our head office as a prototype, which our staff are already benefiting from it. And we intend to ensure that we also take it down to the various rural areas. And we're happy that at least, if not for anything, it is going to be internet compliant based on what Ngozi said, that there is that partnership with Hawaii and to ensure that there is a solar panel integrated in it to ensure that it gives light, so that something that can be used in rural communities that possibly do not have access to electricity, and something that can be easily managed by someone who is neither a nurse or a doctor. So I think we can also go as far as also training some of the people in these rural communities that can also man these machines. So for us in NDDC, we take it seriously. That is why I am personally here, to also support what they are doing, and not only supporting, to ensure that we also become ambassadors of this good thing that has come to Nigeria. Thank you.
That is wonderful. Round of applause for the MD. Thank you so much. That was quite insightful and informative. So in terms, I like what you said. Obviously, it is said that health is wealth. Wealth is health. So a wealthy nation is a healthy nation. I like that very much. So specifically, how can CARE365 be deployed to enhance your operations? I'm coming to specifics now. Are you going to say to us, for example, that within the next 6 months, this is what you will be able to do to deploy this innovation? Thank you.
Well, when we talk about specifics, you know, we're a government agency. We're not just an individual company where I can just sit down here and say, please bring 500 of these machines down to the Niger Delta. It has to go through budgeting and procurement. So I think I have a board. We also have to ensure that we discuss. My board chairman is already in the picture of what we're doing with CARE365. But I can assure you that once we're done with the process, we are going to ensure that CARE365 will be part of our free medical outreach. Because even the last free medical outreach that we did, even the team from CARE365 was on ground with our staff. So I think in terms of specifics, I've already made commitment that we are going to be ambassadors of this. Thank you.
Thank you very much. I think I would accept that. Everybody would accept that. Thank you very much. We hope and pray that this will not be subject to the Nigerian factor, as we all know, so that after we leave here today, it's not done and dusted and we forget about this. So we hope that this will continue and that you will keep to your word. Thank you so much. So we go to the NAFDAC DG. NAFDAC DG. Oh, Ooh, thank you very much, madam. Yes. So my question to you is, how can technology support NAFDAC in delivering its services and operations? Obviously, we know the challenge with the fake medicines and what's going on there in the Nigerian pharmaceutical space. How can technology be deployed to ensure that things begin to get better for the entire country? Thank you.
Thank you very much, Your Excellencies present and others. It is a privilege to be part of this important occasion. 7.5 years ago, I joined NAFDAC from diaspora, and I cannot be prouder for Ngozi for thinking about home. God took us out to bring us back. Ngozi, I'm very, very proud of you. In terms of technology and deliverance of healthcare, as soon as I got to NAFDAC, I knew we have to go digital. About 70% of our processes are digitalized. First, it brings transparency, it brings efficiency, and it links us to the rest of the world. This mobile medical device, we are going to register in NAFDAC. But there are two things that I got from the occasion. First, local manufacturing. To hear that this will be manufactured in Nigeria makes my day, because we have to think of a local content with regards to healthcare delivery. There's going to be e-prescription. We have what is called the Green Book. It is downloadable, and it has at least 7,000 products that we have approved. So that Green Book will also be linked with this device. The Green Book is similar to the Orange Book. When I was in the US, there's the Orange Book of US FDA. As soon as I got to NAFDAC, I said, we need a Green Book. And it has about 7,000, 8,000 approved products right now. So that Green Book will be linked to this. If a doctor is making prescription, that doctor must go through the Green Book. It will assure the doctor that this is approved drug product certified by NAFDAC. We also have what is called the track and trace technology. We use track and trace to monitor millions of doses of COVID-19 vaccine during the pandemic. We are using it, actually we have used it for narcotics because of abuse of narcotics in our country. We are using it now for MNCH products, maternal, newborn, child health commodities, to make sure that the products that we have approved have not been falsified. Along with that, we have scan to verify. It's downloadable, scan the number 2, and then verify. So that any product that has gone through a track and trace or traceability information system can be verified using the Scan to Verify app. So without technology, as a regulatory agency, we cannot move from where we are right now, maturity level 3, we cannot move to 4. So we do not have a choice. Because the WHO that is auditing us, that is doing global benchmarking, expects a strong regulatory agency to be digitized, to use digital tools. We have used also Med Safety app, and I'm going to talk with Ngozi again. Med Safety app is an app that we use to record adverse drug reactions. We have trained over 20,000 healthcare workers during the pandemic on how to use Med Safety app. By recording what side effects patients are undergoing or going through. It helps us as an agency, the pharmacovigilance is domiciled in NAFDAC. It helps to record and transport to base or vigilize at WHO. So we're using different tools to ensure that there is a holistic approach to making sure that effective healthcare delivery is done for all Nigerians. Thank you very much.
Wonderful. Thank you so much, DG. So do we have an assurance today that the pharmacists and the healthcare practitioners with CARE365 will be integrated into your system, for example?
That's a very, very good question. Yes, we have pharmacists that are also monitored or, yes, I will call monitored or licensed by Pharmacy Council of Nigeria. Pharmacy Council of Nigeria and NAFDAC were benchmarked together, and we are going through, the next stage, maturity level 4. We were benchmarked together because Pharmacy Council of Nigeria has the database for all pharmacists. They have the database for licensed sites. So to answer your question, yes, we will need to work with Pharmacy Council of Nigeria in terms of linking licensed pharmacists to this CARE365. Thank you.
Thank you so much, DG. So we go to the MD of NPHCDA. Thank you very much. So obviously you have the responsibility to deploy the innovation, the solutions that have been talked about today to the rural communities. So how would you ensure that your agency deploys these tools, innovations to actually deliver the healthcare solutions to the rural areas? Thank you.
Thank you very much. Your Excellencies, here seated from our presidents, other excellencies, dignitaries, colleagues. Let me start by congratulating Mr. Ngozi and his colleagues for this brilliant and very time-appropriate innovation into the Nigerian health ecosystem. My boss, the Honorable Coordinating Minister for Health and Social Welfare, Professor Pate, who I believe just exited, is overseeing a health sector strategy that seeks to prevent physical and financial pain and produce health for all Nigerians. Within that framework, what the National Primary Healthcare Development Agency has a mandate to do, which serves as the North Star for our own blueprint, is to guarantee every one of us and every one of you, whoever you are and wherever you are in Nigeria, access to basic and high quality care services that you trust. So I will underline a few pieces there and talk to how technology does play a role in everything we do. In fact, there's no way in Nigeria of today that we can start to move in the direction that we need to move with that, the role of technology. That we had to do is to really improve the quality and access, to primary health centers. So we have set a mandate of 17,000 fully functional primary health centers across the country over a 4-year period. We're well along that journey now and working with states, with regional development commissions like the NDDC, and with the private sector to a substantial extent. We are, in fact, revitalizing 3,600 thereabouts as I speak, 1,200 completed. We're deploying equipment to them now. Some of that being done directly by the federal government, some of that being done by resources mobilized by the federal government but being implemented by the states, some of that by the private sector. So the first thing here is, even as we expand rapidly to try to reach every corner of the country, we cannot move fast enough to touch everybody. You also cannot really have physical buildings in every community. I just had a meeting this morning with the MD, the newly appointed MD of the South-South Development Commission, for example, and we were mapping out areas where, even though, you know, riverine areas that are not that far apart, ordinarily, if you just looked at GPS data, but the interlocking water between them means that you can't, what's the value of a primary health center that you can see, but you can't reach from a distance? So there are unique opportunities there to supplement what we're doing in terms of the footprint of primary health centers with non-state actors and solutions such as CARE365, and I see a big role for that there. One of the other things that we're also doing is really retraining frontline health workers. We have retrained over the last year about 69,000 midwives, nurses, doctors, CHUs that are working in rural areas, currently in the health facilities. We're aiming for 120,000 that the president has mandated us to do, and we're on that journey. Now, it's very expensive and not free of risk to pull health workers from every corner of the country, or even at a state level, to bring them to headquarters in a big classroom to do training. That's just not, in Nigeria of today or in the world of today, that's just not the sustainable way to scale up training and do it periodically in a way that they are always up to par. So what are we doing? We're transitioning the frontline health worker training to an e-learning model where, using simple digital platforms, they can access modules and their progress and competencies can be tracked. We're working with local universities to develop these lectures. This is also where platforms like CARE365 come in, because that, I see how that can be easily, you know, built upon what is being done here. But also, even when they are trained, every health worker, by nature of qualification and training, has a limit to what they are able to do. And many times there's a need to refer and consult a higher qualified person. So the ability to do telemedicine is also part of our digitization strategy, where you can connect with another provider, you know, somewhere else, to be able to do this. From a service delivery perspective and planning perspective, we're digitizing our records. You know, when you have paper records, handwritings can be read, cannot be read sometimes, but with digitized platforms like this and some of the EMRs and e-community health information system platforms that we're deploying, you're able to enter the data digitally, you're able to access it, and it's mobile, so that, you know, human beings move. So I can go from Abuja today to my village. If I fall sick, I go to the facility because the information is digital. My records can be accessed, and the provider there kind of has background information. So with platforms like this moving into the rural areas as well, it's by extension, the information will be digitized. And, you know, one of the things that I can commit to is, as this is rolled out and expands, happy to work with the providers to try to make sure that whatever information is integrated and we can exchange information with our network of facilities. The last part of what I said in terms of our objective is that, you know, giving you high quality services that you trust. And how do you get to trust a service or a provider? It's that there is a communication two-way. You know what is going on. You also have a say. You have input into the care that you are providing and where. So the ability to digitally connect with and communicate with our clients, our patients, you know, we see that as a fundamental part of our strategy to try to improve trust in the system. It also teaches us, we learn, because the feedback that we also hear from people, as you added that, it helps us get smarter and tailor services. Of course, working with states, you know, better to the needs of the people. Thank you.
Thank you so much, MD. That was wonderful. Obviously, what everybody is hoping for is a transformative healthcare delivery system in Nigeria that's accessible, that's affordable to every Nigerian. So we're hoping, like I said previously, that this is not a talk shop. We're hoping that there is actual implementation of all these ideas. So that is our hope, and we pray and believe that what's been said today will actually come to fruition. So thank you so much, MD. We go to Ceci Health. Ceci Health, thank you so much for coming. So what sort of impact do you think this will have on the healthcare system in Nigeria?
Your Excellencies, please permit me to stand on the existing protocol. Health is a vital resource in the race of life. And when health is challenged, every other thing, house, money, car, loses value. And that's why they say health is wealth. Africa bears 25%, more than 25% of global disease burden, and can only boast of less than 2% of healthcare workforce. The reverse is the case in the North and the Western world. Now, the challenge is worse in sub-Saharan Africa. And what that means is that healthcare resource, human, financials, seems to be scarce. But when you go back the memory lane, things that have appeared to be very scarce, like aluminium, is the third most abundant in the hard crust. But till 15th century, it was so difficult to extract. So it was very expensive. Even it has twice the price of gold as at that time. But a technology came. That was electrolysis. So it was easy to remove oxygen, silicon, and all those contaminants from aluminium. Then it became cheap. And then today, you use aluminium with throwaway mentality. Technology is a resource liberating force. And when we look at this, as we speak today, the Nigeria of today needs over 1 million new nurses to meet up the minimum requirement by WHO. The government is doing a whole lot to double down on the production, but it will take another 30 years, if everything remains the same, to produce enough. The same thing on the medical side, the doctors. So, deployment of technologies like this in the rural area will be like the ATM of that time. You remember before ATM, you need to queue for months, for days in the bank. They will give you teller. You go to the market and come back, they've not called your number. But right now, you can just, the mama in the market can just go to the one side and then press one button. Simple, and get money. That is what I feel innovations and technology like this can do for. Many have come, and we have ignored them. But it is time for us to look at it this way. Whatever goes digital, we go through subtle, deceptive. So look at that 6 Ds, right? Whatever goes digital, we go through that subtle stage of development, deceptive growth phase. And then at some point, it experiences a disruptive growth. Immediately it experiences a disruptive growth, you will see that it dematerializes products and services, it demonetizes products and services, and then it democratizes products and services. I think if you can look in that direction in healthcare, we may be able to democratize and demonetize quality healthcare across board. And I think that's the potential we have with CARE365. Thank you.
Thank you so much. Thank you. This is what the vision is about, a transformative healthcare delivery that's innovative, that can get to our people in those rural areas. And like President Obasanjo said, we should put this on the same level as the mobile phone, because the mobile phone app transformed Nigeria and the world. So President Obasanjo gave us a challenge today to the captains of industry, to the ministers, to the leadership in the House, to ensure that this app is brought on that same level and has that same transformative power as the mobile phone. And I think that is the message that the MD has just given us today. Thank you so much. So we go to Veritas. MD, Veritas. Obviously, Veritas is in the organized private sector, and you have been fantastic in supporting this project and product. We also have Zenith Bank. They have been wonderful in making sure that today it has been achieved. So how do you think that you can support this type of innovation, not just for CARE365, but in the healthcare sector? Thank you.
Thank you so much, Your Excellencies. Please permit me to stand on the existing protocol. Yes, like you rightly said, we've been involved with this initiative from the word go, with Engineer Ngozi, all the planning. So from the angle of security, that's where we started from. Because in all of this, what nobody is talking about now is the security of this equipment, because that was the first challenge. They bring them in, you're going to deploy them to a lot of rural areas, but what happens to them? What's the security if they just stolen, if they get damaged? A lot of people don't know the value, they just come and do. So we first of all give that confidence, that comfort, to make sure that if anything happens to it, we're there to replace it, put it back in that position it was before the loss. That's on one hand. So they have now the confidence to deploy them all over the country. Rest assured that if anything happens, they can get it back. That's what insurance for. But of course, Veritas family also have an HMO and all of that. So it comes back to also affordability. I listened to the EDC of National Primary Health, also saying collaboration with private sector. That's also where we want to play. So in another area is, in terms of people go there, they do this examination, but they still have to take the treatment. And most of this treatment may not be easily affordable. Then you have health insurance to take care of them. And even in most of the things we do nowadays, group life insurance and all of that, the critical, so it helps, this helps early detection, and it helps people to be able to afford healthcare now. Most of the time, the reason why a lot of people also don't take reduced cover in health insurance is because of cost. Because health insurance is graduated, you have the silver, the gold, and all of that. And then you have an aspect that at coming which deals with critical illness, which a lot of people don't take because it's a bit expensive. But when you do this, and we went through all of this, we'll look at, I must say, in all the health things I've gone through, this is the cheapest. So we're even amazed. This is the cheapest we've seen. Anybody can go. So now you have a lot of people that can have access to healthcare. They go there, they get all of this, and they can come back. So it helps us to also be able to rate people to say, hey, you can get this. And it means an aspect where a lot of people run away from. Why critical health? I'm talking about critical health now. Because you look at the general one, yes, but cancer, stroke, all these ones are what people don't get treatment for in terms of health insurance, in terms of affordability. And it starts with detection, which these are taken care of. So when you do that, then when you also detect, you're able to assess those things. So this is a very good innovation for us to now be able to bring more people into that space, for more people to be able to afford healthcare. Then, of course, we're also offering our platform to CARE365. So what we're doing now is that the database we have, the people we have that, taking healthcare, they can now easily even get reduced price and better cover through using this innovation. So there's a lot, like you rightly said, there's a lot of handshake that is going on where we make sure that more people can come into that space, more people can get access, and more importantly, give security to those equipment. Thank you.
Thank you so much, MD. So can I just ask you, is there any system that can be put in place to ensure that the buying into insurance policies, for example, is accelerated? Is there any way that CARE365 can tap into your own system to accelerate the awareness, the interest of Nigerians to begin to take up insurance policies, for example, in healthcare?
Yes. Yes, one thing we've done again is, so we've incorporated this into some of the policies we have already. That is the easiest and the fastest way. So for insurance policies, you have the group personal accident, the group life. Like I said before, the group life policy, just pay your beneficiary if anything happens after the person is long gone, but doesn't look at the person even while it's here. And most of the things that cause these things are some of these critical illness that I talk about. And sometimes when they send you for medical examination before you take those policy and they discover some of these things, they decline cover. They decline cover. So now if you go and you detect this, and then we've brought in critical illness insurance and you're able to take that cover even before the person dies, he's able to get cover. He's able to get treatment, organ failure and all of those things. People fly abroad. You listen to Engineer Angos when he said people can also come in here to take care of them and all of that. So that's on one hand. Then even in the area of health insurance, same thing. Most of the time, some of the things that make some of this health insurance a bit expensive, if you take a health insurance, you have to go through a medical examination. The cost of that medical, and that's why I'm amazed, the cost of that medical examination, which is built into your health insurance, what this is offering, it's less than 10% of that cost, really. So it's giving a lot of people more access to be able to take this health insurance, because treatment is expensive. So that's why we advocate, and that's why you see primary health and all of that, so National Health Insurance Scheme, preaching health insurance so that everybody can reach, get treatment at an affordable level. So there are a lot of things, and by doing that, of course, it comes back. So it's a win-win thing. Everybody's also come back to know about insurance and, buy more. Thank you.
Thank you so much. As we know, insurance is one area that we don't have a lot of awareness in. That industry is sort of closed in Nigeria. Many people do not even understand why they have to take insurance, whether it's life insurance, whether it's health insurance, or building insurance, content insurance, whatever insurance it is. People do not have that information. So we're hoping that this will open that door for people to begin to access health insurance, especially, because like we said, the health is the wealth. Thank you so much for that. So finally, the last but not the least is the MD of Algon, and your question is very simple. And I'm told you are the closest constituency to the people. So how can you deploy this solution in expanding your operations and making an impact? Thank you.
Thank you very much. My name is Dr. Ben Nkechika. I'm representing the Algon National President and the 774 local government chairman in Nigeria. The local government councils have actually mandated, and I had some discussions with Ngozi while this process was going on, and we are focusing on the sustainability of this program, because it's very key that when this is deployed, it's not just deployed, it's sustainable and it's long-lasting. And the local government chairmen are looking at it from 4 perspectives. One is sustenance of the service delivery, sustenance of the access of the people to always have access to it, and then the sustenance of the financial protection, where they have the resources to be able to meet the financial requirements, and also the sustenance of the fact that the records and the data from this device is able to do reporting, analytics, and for research purposes. When it comes to the service delivery, the local government chairman, based on one of their mandates, is building 1 comprehensive primary healthcare center in every local government, and that's 774 to complement what the National Primary Healthcare Agency and the others are doing. And the strategy is to use a hub and spoke phenomenon in which this device is deployed to the very hard to reach areas, collaborating with the various primary healthcare centers, and they're able to feed these comprehensive health centers on a hub and spoke and a referral system, because the most important thing is finding the patient early. We have one of the worst maternal mortality rates in the country, and the 3 Ds have been identified: delay in decision, delay in access, and delay in getting care. So this picks them up very, very early. And so that is what Argonne is planning to do, that deployment. In terms of access, the issue is that even if you have this and the people are not able to come, or when they come, they are not able to be identified, it becomes a problem. So Argonne is partnering with the National Social Register Group, the NASCO, to take the 70-something million people in the National Social Register, disaggregate it to each local government, and the local government chairman takes all the people in the social register in this local government, identifies them, and able to give them proper identification with NIN and all that. In fact, we are currently partnering with NDDC, like he just mentioned. About 550,000 people have gone through this process, thanks to Dr. Sami Obuku, and their data has been updated and fed back into the National Social Register. NIMSI is now generating NIN for them, and they're able to benefit from the BACPF program and the other programs. But for the financial protection, the local government chairmen have a mandate to contribute part of their resources, 25% in the National Health Act, for health insurance. So the idea now is that with that data completed, the health insurance premium of these individuals, the poor and the vulnerable, will be paid for. And that is what will sustain this project. Because even if the people come there and they cannot afford it, there are quite a lot of primary health care centers all over the country, non-functional, no patients. The issue is the resource availability. The advantage of this is that medical personnel find it difficult to live in these rural communities, and this is a very interesting project that takes out that challenge where a non-technical person can get information in terms of the data and the basics, and through telemedicine, these people can get access to the care. So that financial protection is also part of what the local government chairmen are looking to do. And then last is that the fact that the facilities like this are enabled with ICT data and all that, and the patients that are coming are properly identified with their biometrics, with their NIN, they are part of the social register and all that. So you're able to have a system where their clinical encounter is documented, privatized, and then with that financial protection, we're able to have enough data to do research and carry out several analytics and reporting systems to ensure that this project, this device, not only gets to the communities, is secured. The local government chairmen are the chief security officers of this. Like if you look at this, you can't keep it in an outside location due to weather challenges. So the idea is that the local government chairman will also provide the how and where these devices can all be located. Thank you very much.
Thank you so much. Yes, indeed, you are the closest constituency to the people, and I think we've all received this very well. So thank you so much to our wonderful panelists for your very insightful and informative talk. We're very grateful. I just want to say that, in my view, CARE365 is a call to action, is a call for change, is a call for transformation in the healthcare system of Nigeria. And I think we're all witnesses today to what you have all said. We will hold you to your words. You have made certain commitments, and we will make sure that we come back knocking. We ask that you please do not shut your doors to Ngozi and his team, to the CARE365 team, and that what you have said today, that you will actually deliver. Thank you so much. So thank you, audience, for listening. I hope it wasn't boring. We have learned a lot from the panelists. And like the last speaker said, this is about sustainability, because we don't want it to go the Nigerian way, where it starts today with the pomp and pageantry, and then down the line in 2, 3, 5 years' time, it has disappeared because there was no sustainability. So all hands have to be on deck to ensure that this innovation is continuing, is sustainable, and that they have the support that they need from the private sector, especially the banks. And I see Zenith Bank and all the other, UBA is here as well. So please support this innovation. Thank you all so very much. Thank you.
And please put your hands together for the moderator and the panelists. I think they did a good job of this discussion, enhancing universal health coverage in Nigeria through innovation and technology. I'm told you should stay for a group photograph. Yes, please. Please put your hands together once again for them. While the photograph is going on, let me very quickly run you down the remaining activities. We will be going now to the phase of goodwill messages. Then after the goodwill messages, we'll listen to our very special guest in person of former President Goodluck Ebele Jonathan. And then there will be we will have what we call a rendition of some poetic issues related to CARE365 Health Hub, and of course, we will have some cultural displays. Let me quickly now announce and welcome the representative of the Chief of Air Staff, Air Vice Marshal Anthony Ekpe. He is here. Please let us put our hands together for him. No, hold on. We're just recognizing you for now. But for the goodwill messages, it's going to go this way. We have the Minister of State for the Federal Capital Territory, who is ably representing the FCT Minister, Barrister Nyesom Wike. I'm talking of Hajia Maria Mahmoud Bunkure. Please put your hands together for her as she comes to the podium to deliver a goodwill message from the FCT Minister. Thank you. After her will be the representative of the Vice President, Mrs. Uju Anwuka Rochas Okorocha. She is Special Assistant to the President on Public Health and in the Vice President's office. She will speak after the FCT Minister of State. Please put your hands together for the FCT Minister of State. Thank you.
Thank you very much, the masters of the ceremony. The chairman of the occasion and the former President, Federal Republic of Nigeria, His Excellency Chief Olusegun Machu Obasanjo, GCFR, His Excellency General Abdulsalami Abubakar, GCFR, the former Head of Service, Head of State, Federal Republic of Nigeria, and the Chairman, CARE365 Health Hub, His Excellency Dr. Ebele Goodluck Jonathan, GCFR, former President of the Federal Republic of Nigeria, the Vice President, Federal Republic of Nigeria, ably represented by the Senior Special Assistant to Mr. President on Public Health, Ms. Uju Rochas, all executive governors and their representatives that are here, His Excellency, the Coordinating Minister of Health and Social Welfare, distinguished ladies and gentlemen, I acknowledge you all. On behalf of His Excellency, the Honorable Minister of FCT, Barrister Ezemoyel Sumwiki, the residents and administration of the Capital Territory, I'm honored to stand before you this afternoon and to be part of this important occasion. That's the official product launch of the CARE365 Innovation System in Nigeria. I want to first warmly welcome all of you who have traveled from far across the country and beyond to be part of this historic occasion in the capital city of the nation. I also want to use this medium to sincerely thank His Excellency General Abdulsalami Abubakar and His Excellency Olusegun Obasanjo and all other stakeholders who have worked hard to bring this innovation to our dear country. We say thank you, Your Excellency, sir. This cutting-edge healthcare solution is a testament to the power of innovation and collaboration in transforming our health sector system. CARE365 is a comprehensive healthcare innovation that introduces a health monitoring kiosk, mobile clinic, health hub, telemedicine, mobile and web app, as well as the specialist doctors pool. And all these crucial components are all designed to revolutionize healthcare access and delivery. And this is in order to provide a quality, accessible, affordable, and patient-centered care. Here in the FCT, we believe that CARE365 will help reduce healthcare disparities by providing accessible healthcare services and improving health outcome for FCT residents. We also believe that the innovation, due to its user-friendly interface and seamless virtual consultation, will enhance patient satisfaction and experience. Ladies and gentlemen, while CARE365 holds immense promise, as with most new things, potential challenges in its execution could not be overruled. The effectiveness of CARE365 will rely on robust digital infrastructure and internet access, which may be limited in some areas across the nation. Another challenge might be data privacy and security. Ensuring the security and confidentiality of our patients is crucial for CARE365 success, while the training of healthcare professionals to effectively utilize CARE365 digital tools is also essential for its successful implementation in the nation. However, FCT administration is committed to supporting initiatives aimed at improving the lives and the living standard of the residents, and we will provide all that is needed to support this important innovation. In conclusion, CARE365 innovation has been a potential to transform Nigeria's healthcare system, improving access, efficiency, and patient outcome. I urge all stakeholders to collaborate in ensuring the successful implementation of these groundbreaking initiatives. As for me, as a family physician, I'm impressed and happy with this very important innovation. I thank you all, and may God bless our collective aspiration. Thank you very much.
Thank you very much, State FCT, for those encouraging words and commitment for partnership from the FCT. Please, another big round of applause to Her Excellency. It's now my privilege to call on the representative of the Vice President, Mrs. Uju Anwuka Rochas Okorocha, Special Assistant to the President on Public Health in the Vice President's office, for her remarks. Please put your hands together for her.
My boss, His Excellency, the Vice President of the Federal Republic of Nigeria, Senator Kashim Shettima, would definitely love to be here, but for some unavoidable national issues. But here I am to represent him in such great occasion with the creme de la creme of our nation. This reminds me of a story in my Bible where our Lord Jesus Christ came to John the Baptist to be baptized. Then John said to him, I am not worthy to be baptized or to baptize you, my Lord. But Jesus said, do so that this prophecy may be fulfilled. Please permit me to speak that this program may be fulfilled. The former President and Head of State, His Excellency General Abdulsalami Abubakar GCFR, and the Chairman of CARE365 Health Hub, the former President, Federal Republic of Nigeria, His Excellency Dr. Goodluck Jonathan GCFR, all the representatives of the executive governors here present, all members of the Federal Executive Council, the Minister of Health and the Minister of State, FCT, members of the National Assembly, both past and present, who are here, chief executives of the government agencies, the CEO and founder of CARE365 Health Hub, captains of industries, members of the diplomatic corps, our distinguished personalities, gentlemen of the press, distinguished ladies and gentlemen. Here is the speech of His Excellency, the Vice President, my boss. Let me begin by acknowledging a convergence of minds and hearts here present, a gathering that mirrors the strength and promise of our great nation. I extend profound appreciation to our chief host, His Excellency General Abdusalami Abubakar, GCFR, retired, a statesman whose life duty and dignity continues to nourish Nigeria's democratic journey. To His Excellency Chief Olusegun Obasanjo, GCFR, who has graciously accepted to chair this landmark event, I offer my deepest gratitude. And to our Honorable Minister of Health, Professor Mohammed Ali Pate, other former presidents and governors, eminent healthcare professionals, captains of industries, development partners, and distinguished ladies and gentlemen, I say thank you for honoring this vision with your presence. Today, we do not just set out to launch a product. We are opening a gateway to the future. The CARE365 Hub is both an innovation and a declaration. A declaration that Nigeria is ready to move forward, to rewrite the health narrative with the ink of technology and the paper of collaboration. CARE365 is proof that quickness is not always important, that when vision meets discipline and innovation meets purpose, even most pressing national challenges can find their answers in our backyard. I must commend the tenacity and brilliance of engineer Ngozi Odumoku, the founder and CEO of Silicon Hub, whose leadership has delivered a solution conceived in the diaspora built with Nigeria reality in mind. This digital invention is the life of our nation, and it is an ecosystem where mobile apps, diagnostic kiosks, mobile health hubs, labs, pharmacies, and imaging centers converge into a single heartbeat of care. It is a reflection of His Excellency President Bola Ahmed Tinubu's renewed agenda in action, practical, people-focused, and future-facing. What excites me most is that the CARE365 is not just about an elite. It is built for the child in Karamoda who deserves quality diagnosis. It is for the expectant mother in Ogoja who must not travel miles to find care. It is for the elderly man in Omosho whose dignity should not be defined by distance or poverty. This, ladies and gentlemen, is move. The federal government recognizes that any serious commitment to national progress must begin with health. That is why we are invested in digital health transformation program, and why initiatives like CARE365 are not outliers, they are allies. This platform speaks directly to our goals to strengthen primary health care, expand access to underserved populations, reduce health inequalities, and generate economic value through jobs and local content. What we must be witnessing here, and what we are witnessing here, is not an experiment. It is a tested solution built by Nigerians with global expertise for Nigerians. Let me take a moment to celebrate the quiet force behind this ecosystem. General Abdulsalami Abubakar. Sir, your steady guidance and leading Nigeria's capacity to build, heal, and innovate continue to inspire hope, and we salute you. To the private sector, I say this is your moment. The government cannot do it alone. We welcome more innovations that align with our national vision. Let your ideas be disruptive. Let them be local. But above all, let them be solution-driven. I also issue a clear call to our state governments, partner with CARE365. Let technology find roots in your primary health centers, your rural communities, your hard-to-reach populations. This is not a time for hesitation. It is a time for collaboration. To all development partners, align your support platforms like this. Provide financial and technical muscle to scale this breakthrough across our regions. To regulatory institutions and medical bodies, walk side by side with innovation. Let us make integration seamless, oversight efficient, and policies enabling. And to our young people, the health students here, our developers, engineers, dreamers, look at why your compatriots have built, and look at what they have built for our nation. Nigeria is operating for savings from abroad. Nigeria is building its future from within. As we stand at the edge of this healthcare renaissance, I want to assure you that the federal government remains unshaken in its support for indigenous innovations that solve real problems, not just in health, but in education, agriculture, finance, and security. CARE365 is the kind of dream we will continue to fund, promote, and protect. So today, with pride in my heart, I congratulate the City Hub, the entire CARE365 team, and all stakeholders on this historic milestone. I have no doubt that this platform will be a benchmark for healthcare innovation, not only in Nigeria, but across Africa. And with that, I am honored to declare that CARE365 Health Hub officially launched. Thank you, and may God bless the Federal Republic of Nigeria.
CARE365 is the kind of dream we will continue to fund and promote. Vice President Kashim Shetty, please get a big round of applause for that commitment, that direction, and I believe representing the state governors are here. The Alcohol President is also here, the high Vice President. Let me quickly recognize this distinguished personalities and then we'll go on to represent all the chief chairs for his good message. Alhaji Daidai Hassan, Registrar and Council of Nigeria, has been here with us. Put your hands together and welcome him appropriately. We also have the representative of the ambassador of Turkey to Nigeria, Mr. Edel Fotia Zoglo. Thank you. Now we call on Air Vice Chancellor, who is representing the Chief Air Staff, to give his good message. Please put your hands together as he comes. His Excellency, the Chairman of the Association, General Association of GCFR and Obstetricia,
Your Excellency General Salama Bakaka CFR, Your Excellency the President of Nigeria, President Goodluck Jonathan, GCFR, representative of the Vice President, members of the sector here present. Permit me to stand on the already established protocol. I am Vice Marshal Anthony Chidi Ekebe. I'm the Chief of Medical Services in the Nigerian Air Force. And I'm standing in for the Chief of the Air Staff, Air Marshal Sambalala Bakar, who's unavoidably absent. CARE365 held of an outstanding innovation from our interaction with the team. And I'm telling you, the members of the armed forces are involved in operations in all geographical zones of the country. The Nigerian Air Force has succeeded and reached to conduct medevac and SASAVAC in far and remote regions of the country where our troops are deployed. However, what we have had here today, CARE365 Hub has sort of leapfrogged our ability. That means it has extended it further and faster than we could do. This also helps to reach the healthcare needs of about 12 troops, especially in the remote areas, in the area of psychological support, management of post-traumatic stress disorders, and other health-related issues. However, the Nigerian Air Force, sometime in the past, contracted an agency to give us this telemedicine outfit. Some of the challenges we faced then had to do with data security, internet connectivity, and access to medications. From what the moderator in the interactive session has said, this is just another Nigerian talk show. Access to medications is a primary issue that must be addressed and addressed adequately. If this health facilities is because something we have that and white out and what has always been mentioned throughout the day. And then diagnosis is made and medications need to be delivered. How quickly and how fast can we do that? On our part of the Nigerian Air Force, we want to thank the organizers of this launch today. And we will be very, very willing to integrate the CARE365 Hub into the healthcare profession of members of armed forces, especially the Nigerian Air Force. On this note, I want to congratulate the organizers for this great information, and we look forward to partnering with you. Thank you very much, and congrats.
We have had the commitment of the armed forces to 365, CARE365. Please put your hand up once again to the Nigerian forces. If there are any sector that needs this device, it is the armed forces, because they are an armed way right now. Like I said, on various theaters of challenges that we have across the country. Dr. What is next?
Maybe invite from Aji, one of our vital coaches, to give you goodwill message.
Dr. Aji is one of the partners of CARE365. Please put your hands together for him.
Welcome, sir.
Thank you very much. I know you are quite tired.
must recognize our fantastic chairman, General Absalami. You've done so well. I met you last time at the Kalamba University, and you are chairman also too. And our former president, I want to say that I am emeritus professor Mathematics. I'm a junction with UNH, and I'm the chief clinical officer, consultant for CARE365. And we have restructured program to address almost things said there. The issue of security, issue of drugs, and so on and so forth. You will find that that's an innovation that will carry us so far. This is a game changer for healthcare system in Nigeria. I don't bore you because I know you are all tired, but we are going to make sure we work with you, stakeholders, and Navy, police, and so forth, to ensure that we have a success. Thank you very much.
Thank you so much, Prof. I'd like to call on Dr. Yahya Adamu, also one of our CARE365 clinical chiefs, to the stage. Thank you. A round of applause, please, as I welcome the stage. Thank you, sir. Welcome.
Thank you very much. I want to start by recognizing our father, who has also served as the chairman of this program. I just want to highlight how you put all things together. Your Excellency, sir, the former President of the Federal Republic of Nigeria, I really want to recognize you and give you this honor to come and be part of this program. Really, when I saw the dignitaries, I initially thought it was just going to be one of those power walks. But seeing all of you here gave us all the courage. My name is Yahya Babanu. Like my mentor, Professor Magaji, I'm also a graduate assistant. And I also the medical director and chief executive, Federal Government Center FFP, near Abuja here, some few meters away. As clinical chief partners of CARE365, we are very excited and delighted about this program because we see the dream of rendering primary health care and even the networking and extension to the tertiary care that we have been dreaming about, making it very easy if this is properly utilized by all of us. What we are saying is you have a problem, you should be able to know where to go and when to go there. And I think this is the game changer that will help us achieve this. Without boring so much talk, I want to tell you that we shall all work together to give ourselves the best of health care that we all want in Nigeria from this point. Thank you very, very much.
Having listened to the clinical chiefs, it's now time for more partners. Let's now call on Managing Director, the Executive Director of Zenith Bank. Here, representative is here. She is one of our partners of CARE365, or Zenith Bank, one of our partners, and let us one woman come to our podium for her message.
Round of applause, please.
Thank you very much. Good afternoon, everyone. My name is Adobe Mwamba. I'm here representing Zenith Bank GMD. Your Excellencies, the former President of Nigeria, representative of the Vice President of the Federal Republic of Nigeria, welcome. The Honorable Minister of the Federal Capital Territory, representatives of state governors, distinguished commissioners, the chairman of the directors of CARE365 Health Hub, the chief executive officer of CARE365 Health Hub, captains of the industry here present, distinguished guests, gentlemen of press, ladies and gentlemen. It is my honor to represent the Group Managing Director, CEO of Zenith Bank PLC, Dr. Adora Moji, OONN, at this momentous occasion, marking the commissioning of the CARE365 Health Hub in Abuja today. She deeply regrets her inability to be present today due to prior scheduled engagements. However, I'm here. She has asked me to also convey her warmest wishes to the organizers and all those individuals gathered here. We are deeply honored by the presence of the Excellencies General Salami Abubakar, retired GCFR Chairman, CARE365 Health Hub, Chief Olusegun Obasanjo, GCFR is not here again, but he was here with us before. And Dr. Ebele Jonathan, GCFR, former President of the Federal Republic of Nigeria. Your Excellencies, your attendance at this commissioning ceremony underscores the national significance of this healthcare initiative. Your continued dedication to Nigeria's development, even after years of distinguished service in high space, remains an inspiration to us all. The fact that three of you, our nation's men gathered here today, speaks volumes about the importance of healthcare in our national agenda. We thank you profoundly for gracing this occasion with your presence. Thank you very much, Your Excellencies. Please permit me to begin by paying a special tribute to the remarkable visionaries behind this national project. The board and management of CARE365 Health Hub have demonstrated exceptional foresight and unwavering commitment to Nigeria's healthcare transformation. At a time when many seek solutions abroad, we have chosen to establish a world-class healthcare facility on Nigerian soil. This bold event represents not merely the construction of a medical center or kiosks or clinics, but the creation of a lasting legacy that will serve generations of Nigerians. Your ability to recognize the critical gap in our healthcare delivery system and respond to such innovation and excellence deserves our highest commendation. Furthermore, we acknowledge the courage required to undertake a project of this magnitude. You have successfully combined private sector efficiency with public health objectives, demonstrating that Nigerian entrepreneurs can deliver healthcare infrastructure that meets international standards while remaining accessible to our people. This achievement stands as compelling evidence of what becomes possible when vision meets determination and when business acumen is guided by social responsibility. At Zenith Bank, we have long recognized that robust healthcare infrastructure forms the foundation of national prosperity. A healthy population is a productive population. And investment in healthcare will give dividends that extend far beyond medical square. The CARE365 Health Hub, with its integration of cutting-edge medical technology and comprehensive health services, represents precisely the kind of forward-thinking solution our nation requires. We are particularly impressed by the facilities and commitment to addressing the health needs of diverse population segments by prioritizing both accessibility and affordability alongside quality. CARE365 has created a model that changes the notion that excellent healthcare must remain preserved or be privileged. This democratic approach to healthcare delivery
aligns perfectly with our national development objectives and deserves widespread emulation. The significance of today's commission extends beyond the immediate community that will benefit from these services. This commission marks a pivotal moment in Nigeria's healthcare evolution, signaling our collective readiness to confront long-standing challenges with innovative homegrown solutions. The CARE365 health has tangible proof that Nigerian institutions can conceptualize, develop, and deliver healthcare infrastructure of the highest caliber. On behalf of the board, management and staff of Zenith Bank PLC, I extend our heartfelt congratulations to the entire CARE365 team on this remarkable achievement. Your perseverance and the challenge of bringing innovation to fruition inspires confidence in Nigeria's healthcare future. We pledge our continued support for initiatives that advance healthcare delivery in our nation and remain open to exploring collaborative opportunities that will amplify the impact of this global venture. As we celebrate this milestone, let us remember that achieving universal healthcare coverage requires sustained collaboration among the private sector, government, and civil society. The CARE365 Health exemplifies the transformative power of partnerships. May this facility serve not only as a sense of healing, but also as an inspiration for similar investments across our nation. In conclusion, we express our profound gratitude to all who have contributed to make this vision a reality. May the CARE365 Health fulfill its promise of delivering exceptional healthcare services and may contribute significantly to building a healthier, more prosperous Nigeria. Thank you, and God bless the Federal Republic of Nigeria. Thank you.
Dr. Abdul, Executive Director, Zenith, please in the background also, and Zenith for being good partners of CARE365.
We also invite the Managing Director, NTDC, Mr. Samuel, Dr. Samuel Opu, for his global message. Thank you. Round of applause as he gets your stage, please.
Your Excellencies, our former President, the Minister of State FCT, the representative of the Vice President, the Chairman of CARE365, all the partners. Please permit me to address the well-established protocol. I think I'm happy privileged to be part of our panel to also tell us a little bit what we do in the city, complementing what CARE365 is doing. For me, my good message would be to all of us. This technology is not a solution to ensuring that we are all healthy. It is only to detect and to ensure that you can actually diagnose what is wrong with you. But as Nigerians, we must also understand that our health is determined by what we eat and our lifestyle. So while we have this technology, let us also make the job easier for the technology and medical practitioners by always ensuring that we exercise and we eat right. Once we do that, we'll have a healthy nation. Thank you very much.
Thank you, Sam, for last statement. Exercise and eat right. Thank you very much, Master. Distinguished ladies and gentlemen, it is our privilege to welcome His Excellency Dr. Ebele Goodluck Jonathan, GCFR Special Guest of Honor, to share their round of applause, please.
Please be seated. Thank all of you for being here. Let me especially appreciate my boss, General Abdullah Bagaka, for bringing me here. And as the chair of CARE365 Health Hub. In fact, one of us spoke. He told you how His Excellency managed to bring here. He sent a letter, he sent a phone call, one message, and so on. In one of his just directed to be here. And I got that from my phone, not even the phone call. And I have to tell my colleague, please cancel every other program. Thank you, my boss. Let me appreciate the Vice President being represented by the Senior Vice President and Public Health Committee Administration Committee. Let me appreciate the Minister of State FCT representing the Minister. Let me appreciate all the senior government functionaries with us, number of representatives of non-knowledge, and not more you with a long protocol, because like somebody said, we are all right. And because of that, I will not reveal my message. Because I don't think I have any other thing or any other information to add. We've had everything about the relevance of CARE365 Health Hub. What I would only say is that let me use this opportunity to plead with Nigerian young men and women who are good with technology to come up with different products like this to move our country forward. You know, there's a lot about the industrial revolution, agricultural revolution, etc. The digital revolution has kickstarted various revolutions that the digital revolution. Talk about health, talk about agriculture, about knowledge. Everything is linked to the digital revolution. And if the country is not focused properly, you will lag behind the days of industrial revolution. That's why when I went on my election level, I have to separate the Ministry of Communication from Ministry of Information and Communication, and always the junior minister and communication. So information was in one. We talk about propaganda and government, and the communication that will drive the digital economy was my life. I must separate it. And I'm thinking of a very intelligent Johnson, a lady, to drive this process. The idea is that as people will not go anywhere without the digital revolution. So young Americans don't deploy knowledge for negative things that in this problem of our country. You can make more money using that knowledge, deploying it properly to help us and move the country forward. I remember in October 2017, I was invited by the road group for their road for increases. And a Russian husband and wife, they were invited to speak on digital technology, the way we change the world. And one thing I remember very well is that everything as conservative as the law, as that 2017 integrated and that for 30 years. So many legal officers like my special that was doing their job. Because the world will no longer wait for human interpretation of the laws. They will use robots to interpret the laws. So they have this, so you know this, so you don't know that person, so not the right person for the people all of this was that. That is as conservative like that profession. Even in agriculture, in the 80s, 90s, if you go for conferences in agriculture, they will talk about them thinking fertilizers, and they talk about vaccines, they talk about cross-breeding, hybrids, and so on. Today, when you are attending the international conference on agriculture, more than 60% of the discussion is on the deployment of the digital technology. So I'm so happy with the CEO of CARE365, the young man. I have to thank you very sincerely for bringing this innovation to our country to solve our health problems. We have so much about the relevance of this. And even for those who have money to go anywhere in the country for medical care, sometimes there are problems going to the right place very quickly. I remember in 2007 when I was the governor of my health state, and also the vice president candidate of the PDP then. My chief judge then took me in, and just we couldn't know the problem. We have to send an air ambulance to King Cromwell Hospital in London, and one of the best hospitals in Europe. Cromwell Hospital kept in for some time, but they are on putting in Europe. And God was that they can't know exactly what was happening to my man. And they predicted when he will die. What they said that the problem was more tropical. So they will recommend hospital that no more tropical diseases. And they recommended one hospital in Cape Town, South Africa. So we have flying from Cromwell to London to Cape Town in Africa. In fact, when I visited and I consulted and I said, what is the problem? They said, they can't say what they have only detected strange protein in his body. Strange protein. They kept him longer than the Cromwell was predicted they were going to die. But he died in South Africa. If we had product like this, I don't think we are going up and down. I think one of the things that CARE365 will help is to direct us to the appropriate hospital that you manage for even who have money to go abroad. And of course, for all the discussions, it will help the management of welfare generally. After thank the MD of the NCC, my younger brother, Dr. Amobuku, that already you have built the system and you are partnering with them. Zenith Bank, thank you too, because you are one of the partners. Sorry that is about 30 partners. Let me also commend the state partners for encouraging this revolution in the sector. And that's the way we go. Once again, let me join my boss to thank all of you for coming. I thank you all.
And let us thank His Excellency President, Federal Republic of Nigeria, former President, Dr. Ebele Jonathan, for coming and for this wonderful insight and commendation of CARE365. Please, a big round of applause for him. Everybody appears to be tired and a little bit bored. Speeches. I think for just a little stretching, and then for some of us who would want to laugh, we have MC Black. He's all in black, minus his white shirt, of course. And he will take care of the real activity. There will be a poetic recognition, and we'll have cultural display, but take it over from here, Deep Black.
All right. Good evening, Excellencies, distinguished guests, ladies and gentlemen. I can see, I don't need to introduce myself again. My complexion speaks for itself. Damilare Ezekiel Fashion is my name. I'm well dressed and simply black. If I may ask a question, am I looking good? Yes, I said no. Sorry. Former head of state, am I looking good? Please, President, former President, am I looking good? Representative Vice President, am I looking good? Minister of State, am I looking good? Ma, if they take me any private jet to you kick. You pick me. Oh my God. I feel like crying. Okay. Zenith Bank, they put me any Chihuahua you pick me. You pick me. Oh, I feel like crying. Okay, ladies and gentlemen, everybody here, they put me any $1 million you pick. Are you serious? Okay, wait. They put me here, they put $500 million John we pick. Okay, wait, let me have the $100 million John we pick. Okay, let me have the $50 million John we pick. Let me have the $20 million John we pick. Let me have the $10 million John we pick. Let me have the $5 million. They put me here only in Nigerian. They put me here, they put $1 million John we pick. They put me at 500,000 John we pick. Okay, let me have the malaria John we pick. All right, ladies and gentlemen, if you said you are going to, it means if you pick malaria, don't worry. That's why we are here. 365. Please get up for the. All right, ladies and gentlemen, I see at least everybody's in the now. That's why you're living in black. Okay, so right now, I'll call it on for a poetic rendition by a fantastic lady. Please, ladies and gentlemen, many of them are not easy. We are here together for Fatima Adam. Thank you.
A blessed day, everyone. Please permit me to stand on the system protocol. I am Fatima Adam, a writer, poet, and a spoken word artist. So the title of my piece today is When Innovation Becomes Medicine. Nigeria, our mother with a strong back but a bleeding heart. How long will we witness write our stories? How long will a mother walk miles with every child? Only to meet an empty clinic, a doctor's empty clinic, a doctor's table with no doctor, a bed with no sheets, a life hanging, waiting and waiting. How long will blood pressure rise unseen? Diabetes eats in silence. Malaria laughs at us in the dark. How long will we bury dreams because healthcare became too late? But today a new song begins. Today innovation walks into the room with a stethoscope of hope. Today a 365 health day. No more waiting, no more silence, no more distance between life and here. A kiosk that speaks like a doctor. 40 heads in minutes. Sugar, cholesterol, malaria, typhoid. The body telling secrets printed toward the member. Not lost to dust, but lost to forgetfulness. Not lost to forgetfulness. An hour that never sleeps. A doctor in your pocket, remind you to breathe. Take your pills to call for help. And when danger comes, it's now siren before you cry. Before the cry leaves your lips. This is not just science fiction. This is Nigeria 2025. This is health in every hand, health in every street, a lifeline in every palm. CARE365 isn't just a hub. It is the bridge for the villages forgotten, a voice for the busy cities gasping, a hand stretched to children in school, workers and companies, farmers in the fields, families in their homes. Because health should not be a privilege. Health is a right. And today, technology bends to serve humanity. So let the world know, from Abuja to Creek, from Sokoto to Lagos, Nigeria ready to rise, ready to say innovation or medicine tomorrow being today. CARE365 is not just a name, it is just a machine. It's the heartbeat of a nation learning how to live again. Thank you.
Thank you very much, Fatima. As we all know, Nigeria is the best country in the world. Yes. If you believe Nigeria is the best country in the world, please experience that in Nigeria. Please raise the price next to you. Say name, God bless Nigeria. All right. So next is cultural display, and in Yoruba, I'm saying Ekason. Hausa, they will say Inauri. That sounds like Chinese, right? Okay, so ladies and gentlemen, if you're not noticing, please go ahead and get a 4 magic step as they come the cultural display. Thank you.
And to formally appreciate our guests and dignitaries, may we invite Dr. Amina Abubakar, CARE365 Clinical Chief and board member of CARE365, to come and give a vote of thanks. And for your information, she is also a medical doctor and former First Lady of my state, Niger State. And while there as First Lady, she was going to the hospital, practicing what she knows best. Please put your hands together for her.
Good afternoon, distinguished ladies and gentlemen. I'm happy that I'm the one that's going to let everybody go home after such a long and productive day. So my right is just to thank everybody. And I will start with our distinguished chairperson. On behalf of the entire 365 Health family, I stand for all of you with a heart full of humility for today that has been an inspiring and historic moment in our journey to redefine healthcare delivery in Nigeria, Africa, and beyond. We want first of all express our profound gratitude to the chairman of our occasion that has had to leave. On this occasion, His Excellency Chief Justice Olusegun Obasanjo, for his unwavering support and leadership. Most of all, I want to acknowledge and especially thank our distinguished chairman, His Excellency General Salami Abubakar, GCFR. We are deeply grateful, sir, for your guidance, wisdom, and fatherly presence throughout this journey, and for having the patience to stand from last night. His Excellency was here even in the evening when both the Minister was here up until 9 p.m. to make sure everything was going well. And he's here to the very end. Your Excellency, we thank you very, very much. We want to thank the honorable coordinator who has gone for being here in the and launching our product. We also extend heartfelt appreciation to our special guest of honor, His Excellency Dr. Goodluck Jonathan, for gracing this occasion and lending his voice for this cause. And also thank you for listening to his boss as soon as possible for him to come. Thank you very much, Your Excellency. We want to thank all our distinguished members of the Executive Council who are here, who have graced us. We want to thank our Minister for State. Thank you for staying all the way from beginning to the end. We are very grateful. Our panelists, partners, and goodwill messengers, your contributions have been reached us today and strengthen the vision of CARE 365. Our gratitude goes to our other esteemed dignitaries, the representatives of governors, our captains of industry and financial sectors, our partners, Zenith Bank, and everybody here. We cannot forget also our clinical teaching and health professionals, media houses, the cultural group that has just graced us with a wonderful performance. And finally, all our invited stakeholders and well-wishers who have one other invitation. Your support means the world to us, and we do not take it for granted. As we close this launch, let us remember that the 365 Health Hub is not just a product, it is the promise of a health community and a bright future for Nigeria. Thank you all, and God bless you. God bless you all as you go back to your respective home. Thank you.
Please, put your hands together for Dr. Amina Abubakar Bello, CARE365 Clinical Chief. It's now time for the four photographs. And the photographs are going to go this way. First of all, I use the privilege call on our chairman, former president, former head of state, General Abdulsalami Abubakar, come over here. And then we will follow by former president, Dr. Goodluck Ebele Jonathan, GCFR, and of course the CEO and founder of CARE365. Those three will take group pictures first, and then they will stay where they are, and they will be joined by Minister of State for SSC, the representative of the Vice President, the representative of the MD of Zenith Bank, and representative of Chief of the Air Staff, and all the important dignitaries that are here at the front seat will join the leader. Now, first, our chairman, President Goodluck Ebele, and the CEO, founder of CARE365. Please put your hands together for this very distinguished person standing in front of you. Put your hands together for this. It is no mean feat to have a vision and to actualize the vision. And today we have launched this CARE365. We pray very well it goes to look and training. In fact, beyond Oren Namuda, like everybody says. Amen. Now, the Minister of State, representative of the Vice President, representative of the two states or three states governors here, representative of the governors of Niger, Nasarawa, Bauchi, Jigawa, and representative of the Chief of the Army, Air Staff, and representative of the Ministry of Interior, and of course, Dr. Amina should also join, representative of the NEC, MD, please join. Yes. The rest of us, please give them a big round of applause, just like it is something what celebrated. We've had a good lunch, and we look forward to actual implementation. Governor is over here. Yeah, photographers, are you done? Are we done? Thank you very much. Please, put your hands together for this great Nigerians. Put your hands together for all of us. Yeah. Thank you. Shall we have the national anthem, please? National anthem. National anthem. National anthem. Thank you very much, ladies and gentlemen. This concludes the official program. You are warmly invited to join us for the networking lunch and exhibition walk. Thank you for being part of today's celebration. Thank you.
Thank you.